Good morning, everyone. Welcome to today's episode of What's Gone Wrong in the World. We will be discussing substance abuse for our topic of the day. And for those of you who aren't aware, America has had a war on drugs since June 18th, 1971. Now, in 1982, Reagan's administration started prioritizing drugs. However, the situation since then has only worsened. Now, an important quote from a book I enjoyed, War on Drugs or War on America by Doug Bandow. Drug prohibition has made the use of drugs more dangerous and pushed users towards deadlier substances. We can't win anymore. Drugs will never go away. I 110% agree with this statement, and I personally believe if we were to begin decriminalizing substances, we would actually see a decrease in overdoses and substance use. Substance Abuse and Mental Health Services Administration Center for Abuse spends an annual cost of $510.8 billion in treatment. Now, the real problem that we are facing is that we do not treat addiction as a disease, we treat it as a criminal offense. However, it is a disease, and if we were to treat it as such, we would see a decrease in taxpayer money, overdoses, and incarcerations. The American Medical Association labeled drug addiction as a disease in 1987, alcoholism as a disease a little bit prior to that. A big social stigma that comes with drugs is how you were seen. You are seen as someone who has flaws in their morals or flaws in their personality. You're seen as a criminal. If we were to start normalizing that addiction is a disease and society was more informed when it came to that, I believe the stigma would definitely start to change. Now, the opioid epidemic is by far the most controversial and most important topic of substance abuse. Big pharmaceutical companies are definitely responsible for this epidemic. And it's important to note that from August 2013 to December 2015, $39.1 million were spent towards opioid marketing. Now, in 2017, U.S. saw the largest spike in opioid overdoses. Now, what I find the irony in this is that you have these pharmaceutical companies who are having their reps come to the doctor's offices. The doctor's offices are sold. And now the doctor's offices, these doctors like to have their patient surveys come out good. They like to please their customers. So when you have customers coming in and asking for opioids, what is the doctor going to do? Of course, he's going to overprescribe it. It gives the pharmaceutical company money. It gives him money. It gives him good reviews. And that's where the system gets a little flawed. And that's where I think a reform should be done for sure. But just another thing gone wrong in America. Now, a study relating to this, there was a clinical trial on opioids, and they found that patients who used other marketed prescriptions to get off of opioids ended up being clean after 9 months. However, there was a small subset of people who ended up getting addicted to heroin. So that was an interesting study. I think there needs to be some more studies done on that. What most people aren't aware of is that addiction comes from biology, genetics, and psychology. The Association of Drug Abuse and Child Abuse did an experiment on in utero substance use with mothers, and they found that the mothers who were using substances while the child were in utero had a higher rate of being addicted when they were older. Another interesting fact is that if you have ADHD, BPD, PTSD, and a few other types of mental health disorders, you're actually more prone to being addicted to substances because of the chemicals and how they process in your brain, the dopamine and serotonin. And then a genetic way of looking at addiction is if you have multiple females or males on the maternal or paternal side of your family with addictive traits and being treated for addiction, you most likely will carry the gene. And I do think there is a test you can do to find out if you have addictive traits. Another important problem when it comes to substance use is the overcrowding in the jails. Roughly 1.1 million to 1.7 million people a year are arrested for substance use. Another thing gone wrong in America. Now, if we were to treat that as a disease and we treated those people in maybe like a substance reform program where they're doing rehab, not only would they not be incarcerated and our jails would not be crowded, but they would also be getting the help they actually need to heal and get better. Now, the Journal of Criminal Law and Criminology says that U.S. imprisons more than 2 million of their citizens, and it costs about $80 billion a year to sustain the prisons, and we don't even have enough money to afford that. And, not to mention we're also in a crap ton of debt. But the judicial system does not see addiction as a disease. It sees it as a criminal offense. And that just shows you how monetized and capitalized everything in this world is. To end today's episode of What's Gone Wrong in the World, first thing, don't do drugs. Second, be supportive and understanding to your family members and friends. Do not think that they are flawed or they're a criminal. They're just suffering from a disease. And also know your consequences. It may be a good time, but you're going to have a long time of regrets.